Auxiliary low back exercises. The exercises in this section gradually increase low back mobility and strength. All of these exercises should be done within a pain-free range of motion. Do 8 to 10 repetitions of each exercise. Exercises to be done on all fours. Begin these exercises on your hands and knees with your back relatively straight, shoulders neither hunched nor retracted, the hands directly under your shoulders. The cat. Imagine that your spine is like a piece of elastic and arch your back up toward the ceiling. Return to the neutral position, spine parallel to the floor, and then reverse the curve, arching your spine toward the floor. Keep the motion rhythmic and continuous. After each motion, return to neutral and then begin again. The dog. Move your hips side to side like a dog wagging its tail. Think of moving your right hip toward your right ear and vice versa. Weight shift. Shift your weight so that most of it is on your right hand and right knee. Still keeping contact with the floor or ground surface with your left hand and left knee. Then shift your weight toward the left. Do that a few times. This is in preparation for the next exercise. Leg extension. Extend your right leg behind you so the foot and knee come off the floor and the knee straightens. Lift the leg until it is in line with your hip and parallel to the floor. Return it to the neutral position and repeat with the left leg. Arm extension. Extend your right arm in front of you until it comes to shoulder height. Return to the neutral position and repeat with the left arm. Do this several times. Arm leg extension. Combining the two previous exercises, extend your right leg behind you and your left arm in front of you, both at the same time. Return to the neutral position, then repeat with the opposite arm and leg. Exercises to be done prone. Leg extension. While lying face down on the floor or ground surface, slowly raise your leg and then replace it on the ground. Then repeat with your other leg. For a variation, raise the thigh and scissor it over toward the other leg. If this is uncomfortable across the front of the hips, place a folded towel under your hip bones. Exercises to be done supine. Pelvic tilt. Lie with your knees and hips flexed and your feet flat on the floor or ground surface. Tilt only your low back and pelvis so your coccyx moves up to the ceiling and then down to the floor. This is a small movement that raises only the pelvis off the floor. Pelvic tilt through the back. Again, lie with your knees and hips flexed and your feet flat on the floor or ground surface. Tilt your lower pelvis forward toward the ceiling, and then slowly flatten your low back on the floor as you did in the previous exercise. Gradually increase the tilt, allowing the hips, then the low back, then the mid back to come off the floor. Pause, then slowly roll the spine back onto the floor. As you do this exercise, remember to keep your feet rooted into the floor with the weight of your body on your feet, while you lift off the ground. Do the movements slowly. The abdominal muscle should remain lengthened as you roll up and down. They should not tighten up at any point. Pelvic clock. Don't add this exercise until you're able to do the previous 2 exercises with no discomfort. Begin in the same position, lying on the floor with your knees up. Slowly tilt your pelvis and lift it toward the ceiling. Focus your attention on the center of the sacrum, just above the coccyx. As you lower your pelvis, take it to the 5 o'clock position rather than straight down to the 6 o'clock position. On the next tilt, bring your pelvis down to the 4 o'clock position, bending it even further to the side. Now work your way back slowly toward 6 o'clock and move toward the 7 and 8 o'clock positions on the other side. Depending on the client's needs, capabilities, and injuries, a person can typically do the dog, the cat, the weight shift, and the pelvic tilt in the first week. You can give the remaining exercises in the second and third week.